Good evening, everyone, and welcome. I am Yvette Lewis, the chair of the Maryland Democratic Party, and we are hosting tonight our final Burgers and Brews gubernatorial forum. This is our fifth one, I think, and we are here in beautiful Baltimore County. You know, when we started this program, our goal was to move our candidates around the state as much as possible, but we wanted to go to areas where we need to make sure that Democrats know that they have a Democratic Party that is invested in them. So we started our first one in Charles County, and then we had to do one that was virtual because of COVID. We did one in Frederick, we did one in Salisbury, and now we are here in Baltimore County. Once again, the goal was to move our candidates around. Our original intention was to have perfect attendance at all of these because we wanted you to be able to see the candidates. So we did not allow surrogates because we hoped that that would encourage the candidates to come to all of the events. Sadly, that didn't happen because of conflicts in schedules, which often happens, but tonight we were determined to try to get as close to perfect attendance as possible. Unfortunately, two of our candidates were not able to join us, but we did allow a surrogate to come, and we offered the surrogate opportunity to another campaign, but they did not take us up on the offer. My goal always is to make sure that we give you as much information as possible. And the only way you can make an informed decision is if you hear from all of the candidates or their representatives. So that is why you see a surrogate here tonight, Aruna Miller, and not the candidate. But this being our last one, we felt that it was important to make that exception because this is the last opportunity that we have to do this. You should also understand that we feel that we owe this to you, the people of the state of Maryland, to make this information available to you so that you can make an informed decision about the people that are asking for your vote. So listen carefully and choose wisely. This is a very serious election that we have coming up, and we cannot afford to get this wrong. So I hope that you all enjoy our evening and sit back and relax. Before we begin, though, isn't this a fabulous space that we're in? I would like to welcome the owner of the BC Brewery, Mr. Rich Mark, to say a few words.
Welcome, everyone. I wrote this down, thank you. I'm Rich Mack, the owner. Thank you for choosing our brewery as host to this event. I hope everyone gets to try some of our great Maryland beers, all of which are brewed on site. But Maryland beer is Maryland beer is about more than just brewing local beer. It's about creating local jobs, generating local taxes, bringing tourists into the region, and supporting our local communities, all while creating a great product. As our comptroller knows from his years of supporting Maryland beer, the industry brings an economic impact of over $650 million annually. Yet Maryland is at the bottom of the list nationally in number of independent breweries, jobs created, and economic impact. So lots of room for growth. Customers today have so many buying choices, be it online, carry out, delivery, and yet our beer laws are based on consumer values from 1940. After the challenges of the past 2 years, I think we all realize that things can be done differently and that changes to norms are not necessarily a bad thing. I wish everyone on this stage good luck tonight, and we look forward to your support as Maryland beer continues to grow and prosper. Cheers, everybody.
So much. Thank you. One of the things that I'm so excited about in my role as chair is working with the dynamic central committees that we have here in the state of Maryland. And I have some fantastic partners in not only the central committees and the central committee chairs. One of my best partners, who is such an outstanding leader, that has been an amazing friend, an amazing supporter, and just a fantastic Democrat. Baltimore County Central Committee Chair, Dr. Crystal Francis.
Baltimore County Democrats, good evening. We are so excited to be able to host this final Burgers and Brews Forum to hear from the amazing slate of candidates that we have here. The one thing that we can make certain, if we continue to do that hard work, that we will elect a Democratic governor in the state of Maryland. And we know that the Central Committee has been the backbone and the grassroots energy to the Democratic Party. I want to welcome you all here. I see a lot of our leaders in the audience, Congressman Dutch Ruppersberger, Delegate Ben Brooks. Thank you so much. We also want to give honor. I see Delegate Ben Dari and Carl Jackson here. Thank you so much to our county executive, John Yoshefsky Jr., who's making Baltimore County government more open and transparent. You're going to hear a lot. We have, several weeks left before the election. And the one thing that I hope to encourage all of us to do is make sure that we get out the vote. We know that just sheer numbers, Democrats can turn Maryland blue and make sure that we're sending a Democratic governor to Annapolis. The topic that we're going to hear about today is healthcare, and healthcare is so critically important, not only across the state of Maryland, but here in Baltimore County. Whether that's the reproductive rights, whether that's the rising cost of prescription drugs, expanding healthcare to uninsured Marylanders, or expanding training for healthcare workers, we know that a governor who has a strategy to improve healthcare in the state of Maryland is the person that we need. And so, welcome, and let's hear what our governor candidates have to say. Make your choice, but encourage each and every person in your household that is eligible to register to vote. If you're watching online and you are not registered, please go to www.iwillvote.com and register. We have same-day voter registration here, but the deadline is going to be June the 28th. We're gearing up for our early vote, which is going to be July the 7th through the 14th, and general election day on July the 19th. So get out and vote, and make sure you take a family or friend with you to the polls. Thank you.
So now it is time to begin. I am going to introduce our moderator for the evening. She is no stranger to us because we've known her in several iterations. Pam Wood covers Maryland politics and government for the Baltimore Banner, focusing on how powerful people make decisions that affect daily life for people living and working in and around Baltimore. She previously reported for the Baltimore Sun, the Capitol, and other Maryland newspapers, and on topics as varied as politics, local government, the environment, healthcare, and breaking news. She spent most of her life in Maryland, graduating from Howard High School and earning a degree in journalism from the University of Maryland, College Park. She now calls her home Anne Arundel. But we are so happy that she is with us here tonight. I am looking forward to a very spirited conversation from a very spirited moderator. So, Pam, the floor is yours.
Thank you. Right, thank you very much, candidates who are participating tonight, everybody here at BC Brewery, and the folks watching on Facebook. First, we're going to go over the rules and how it's going to go tonight. We ask that everybody in the audience be mindful of the fact that this is streaming online, so if you are talking and making noise, clapping, cheering, that makes it impossible for people to hear on their little computer speakers at home. So please be mindful and try and be quiet so everybody can hear what these candidates are saying. Now, also for everybody here in the room, note cards are being handed out. And if you have any questions for the candidates, please write them down on the note cards. Democratic Party staffers will come around and collect them, and we'll hopefully have a time for a few of those questions at the end of the program. Now, to the candidates. For each question, you will have 1 minute and 15 seconds to answer the questions. For the audience questions at the end, you will get 1 minute. We have folks here with time cards. If they could show, can you all wave the cards to see? There's your warning times. Please pay attention to them, and please follow the rules so that I don't have to cut you off and tell you to stop talking. So please keep an eye on them. Now, first, I will introduce all of our candidates. I think they should be familiar by now. They've done a lot of these forums. But in case you don't know, we have Rashern Baker, former Prince George's County executive. We have John Barron, a former Clinton administration official. Next, we have Doug Gansler, former Maryland Attorney General. We have Ashwani Jain, also a former Obama administration official. We have John King, former U.S. Secretary of Education. We have Aruna Miller, former state delegate. She is the running mate of Wes Moore, who couldn't be here today. Next is Tom Perez, former chair of the DNC and U.S. Secretary of Labor. And right here next to me, we have Jerome Siegel, author and researcher. Okay, so here's how it's going to go. We have 10 questions that I will be asking you. Only the 10th question will go to everybody. Each question will go to only 3 candidates. That way we don't have like this line of all of y'all saying the same answers to the questions. So we're mixing it up a little bit. And it's going to rotate the order. So, and just a reminder, follow the time card. So the first question is going to go to Mr. Baker, Mr. Barron, and Mr. Gansler. So you all pay attention. All right, a recent study ranked Maryland 6th place among states with the best healthcare system, which is down from 2nd place 5 years ago. What would you do to ensure that Maryland resumes its place higher up in the top tier of best health systems in the nation? Let's start with Mr. Baker.
First of all, thank you for the question, and thanks for having this forum here today. This is something that I know firsthand. I actually was county executive of the 2nd largest jurisdiction, but one of the jurisdictions that had the most uninsured and underinsured at the start of my administration in 2010. Baltimore City was the other place. Here we are in one of the wealthiest states in the wealthiest nation on earth, and yet many of our folks did not have adequate health care. And we've seen that drop over the years. I actually served on for 3 years on the University of Maryland Medical Systems Board and looked at health care throughout the state. What we have to do from a state perspective is not treat health care as a priority, but not as treat it as a right. We have to move toward universal health care, Medicare for all. That is something that I pledged to do as governor. Is something that I learned because looking in Prince George's County with all the number of folks who didn't have health insurance and the strain it had on our system, we have to move toward there. Maryland should be a leader in the nation. I will do this as governor.
All right, thank you. Mr. Barron, your answer, what would you do to improve the standing of Maryland's healthcare system?
Well, Maryland has done well, thanks in part to Obamacare, in increasing coverage. We now have only 6%. It's down almost half from what it was 10 years ago that are uninsured. But the area where we are not doing as well, one key area, is healthcare costs. The average Maryland family pays 50% more in out-of-pocket medical expenses than they did 10 years ago after adjusting for inflation. That's about $3,000 per family. What my administration would do is to expand innovations in healthcare delivery that have been tested and proven to improve health and reduce cost. As one example, there's a program developed in Los Angeles that pairs black barbershops with pharmacists. So when the men come in to get their hair cut, they get screened for high blood pressure, and if needed, they get medication. It was shown to reduce the rate of uncontrolled high blood pressure, which is a leading killer of black men, by more than half. And of course, if you do that, you're also saving money by preventing heart disease and stroke and kidney problems and other problems downstream. It's a common sense intervention. It's been shown to have a major effect on public health. we should be doing this and other examples of proven programs throughout the state. That's what I would do as governor.
Thank you, Mr. Barron. So same question, Mr. Gansler.
Thank you. I think the question is part of the answer, which is we are one of the best healthcare systems in America, and so we don't need to upend the system. We need to build upon the system. And one of the reasons why we have such a great healthcare system is because of the Affordable Care Act. When I was Attorney General, I led 11 other states to make sure that the constitutionality of the ACA was upheld with the Supreme Court, and it was. Experience matters. I was in government for 23 years, taking on corporate interests. In fact, we took on every pharmaceutical company you can think of. We took on, and we got multiple millions of dollars back into Maryland because they were cheating people and on pricing, on off-label marketing, deceptive advertising, and pricing versus genetics. So that's the kind of thing we need to have a governor that understands the levers of how government works to make sure we get the best and the brightest in the room, figure out the solutions, have more healthcare clinics in underserved communities, make sure everyone has access to healthcare, and someone who is willing and has been shown to be willing to take on the pharmaceutical companies and the insurance companies.
Thank you. All right, the next question is for Mr. Jane and Mr. King. We're going to turn to healthcare for seniors right now. Yet another study ranked Maryland 39th for senior healthcare in terms of cost, quality, and access. How would you improve the quality of care and the cost for our seniors in Maryland? Mr. Jane, you go first.
Yeah, thank you so much for that question. So as someone who's a cancer survivor who used to work at the U.S. Department of Health and Human Services, I was one of the directors of then Vice President Biden's healthcare program called the Cancer Moonshot, and I'm still working full-time in a healthcare nonprofit called the National Kidney Foundation. I understand that you need to tackle the issue of healthcare in a very comprehensive way. So to the question about how do we take care of our seniors, I take care of my grandmother right now, and I've seen some of the inequities, not only as a senior resident, but as someone who also does not speak English as a first language. So that's where you have to make sure that you're creating more health enterprise zones, so actually giving providers more incentives to open up in rural communities, in communities of color, in low-income communities, invest in community health clinics that are fully funded, making sure that we actually create a caregivers program for the state to offset some of the costs that individuals have when they're caretaking for someone who is elderly or has a disability, making sure we have more dedicated funding at the statewide level to county governments in their senior service agencies, making sure that we also prevent predatory billing from a lot of these hospitals and providers that oftentimes imposes so many more added restrictions for our elder residents.
Thank you. Mr. King, same question. How to improve healthcare for seniors?
Yeah, such an important question. I spent time just this weekend on the Eastern Shore talking with folks about the challenges they're experiencing. One of the key issues for our seniors who live in rural communities is being able to get to where the specialists and providers are. Too many of our communities, the providers have closed or there are no specialists available. So we've got to make sure that there are incentives for specialists and providers to locate in those communities. We've got to make sure that we invest in our healthcare infrastructure. I think about the regional hospital that was built in Prince George's County. That's a great addition to the county, but because of Governor Hogan's short-sightedness, it doesn't have enough beds, it doesn't have enough emergency room patient opportunities, and so we've got to make sure that we're making that infrastructure investment. Transportation is a huge challenge for seniors. We've got to make sure that we invest in a public transportation system and in services like mobility so that seniors can actually get to their care providers. And then we've got to address the crisis of care in this state. There's a list of thousands upon thousands of people waiting for in-home care. That's a place where the state has to lead so that folks can stay at home and get the care they need.
Thank you. All right, next question, as you may guess, is to the next three, Ms. Miller, Mr. Perez, and Mr. Siegel. Nearly 25% of people in Baltimore live in food deserts. And actually for children, it's an even higher rate of 30% of our children live in food deserts. What would your administration do to bring more healthy and affordable food to people in Baltimore City? Start with Ms. Miller.
Thank you very much. Can you hear me? All right. Thank you, Pamela, for that question. Thank you to everyone who's here today. There's a lot of things that we can be doing about food deserts. In fact, 1 in 8 Marylanders have food insecurity. 1 in 4 Baltimorean residents in the city have food insecurity as well. So some of the things that we can do is make sure that they have access to good food. So that means having transportation. A lot of times you can't get to supermarkets when you don't have public transportation to take you there. Instead, you're going to places like the convenience store or fast foods in order to be able to access food. Some of the other things that we can also be doing is making sure we educate our population more to know what the difference is between choosing the wrong foods versus the good foods. And we also can make sure that we will reinstate the Governor's Office of Children, where we could possibly expand its scope to make sure food security becomes a part of one of the missions of this group, because there is food security when it comes to school children who are shamed at lunches and for the debt that they owe. So we need to change a lot of things regarding food security. Thank you.
Thank you. Mr. Perez, how would you approach food deserts?
Well, we need to invest in it. Budgets are moral documents. They reflect your priorities and your values. And we need to work together with large providers, Giants and Safeway and places like that. There's about a block from where we have our campaign office, right near Hopkins. There's a remarkably open space. When I was walking with the East Baltimore development folks, I looked at that plot and I said, that's where the Giant's going. Now, the governor is going to have to maybe put skin in the game to incentivize that. I'm fine with that, because you should be able to walk to your grocery store or get there really, really easily. It's part of a broader issue, though, of how do we build Baltimore so that we have all the amenities. And that involves a comprehensive partnership between the governor and the city of Baltimore. This governor has spent way too much time deriding the city of Baltimore. As Baltimore goes, so goes the state of Maryland. And as your governor, we're not only going to work on food deserts, we're going to work to make sure that you don't go to school in 90-degree heat in your school because it doesn't have air conditioning. We're going to make sure we address the lead paint challenges that are major league public health challenges, issues I've worked on. The entire array of things is what we need to do.
Thank you. Mr. Siegel, your thoughts on food deserts?
I lived for a number of years in Philadelphia, which is actually a city. Are we on? Could you start the clock over, please? I lived for a number of years in Philadelphia, which is a city a lot like Baltimore. And I lived in a rough part of the town, and we were in a food desert. And the key thing really was empowerment and self-empowerment of the people there. And what we did is we started a food co-op. And we leapfrogged, actually, the middle-class neighborhoods, and we had wonderful foods and co-op participation and organization. So I would look towards empowerment of the community itself. More broadly, I'm running as a bread and roses socialist. And as a socialist, we approach all of these issues in a very different way. We believe from each according to their ability, to each according to their needs, which is the model of a family. In other words, we don't distribute resources according to what the market tells you your labor is worth and in terms of what you can sell your labor for. It's basically we're part of one big family. We recognize everybody makes a contribution and everybody gets their needs taken care of. The roses part is actually more important, and we're interested actually in positive health and in people flourishing, not just health care, but the social determinants of real health. Thank you.
Thank you. Okay. We're going to go back to the other end of the table. This question, we're going to start with Mr. Barron and then Mr. Gansler and Mr. Baker. So when we think of healthcare, it's not just physical health. Mental health is an important component, and it's also a challenge for people to access it and pay for it. What would your administration do to address deficits in our mental health care system in Maryland? Mr. Barron, you go first.
Thank you. So this is an issue that I understand at a personal level. I myself had problems with anxiety when I was social anxiety when I was a teenager and into my 20s that I worked on for many years. I was lucky I got an evidence that was connected with an program that had good evidence that actually worked, cognitive behavioral therapy, that taught me how to think differently, and I still work on it sometimes, but on the other hand, sometimes I get nervous up here on the stage. However, we need to provide a greater expansion of programs that have actually been tested and shown to work. There are certain kinds of mental health treatments. Cognitive behavioral therapy is one of them. There are programs for preventing repeat suicide attempts of kids who have had either suicide ideation or have had one attempt that have been shown actually to work by having them identify people in their support group, in their family, who are then trained to identify the signs and the rest, that have been shown to reduce suicides by more than half. One thing that I would do differently and systematically is to expand Medicaid coverage in the state for solutions that have been tested and shown to work, like the ones I just described.
Thank you, Mr. Barron. Mr. Gansler, how would you address the gaps in our mental health care system?
Well, thank you, Pam. This is a question that has only been asked recently, and it's a great question, and it's an incredibly important area. We used to sweep the idea of mental health problems under the rug, and we need to really address it full on and straight on. One of the things I've recommended is for every school, we have a mental health professional, licensed mental health professional for every 250 students. Because as we just saw with the shooting in the school in Texas and so many other shootings with young people, which is, I believe, crime is our #1 public health problem right now, that we need to make sure that all students have access to health care and a mental health professional. In addition, first responders, police officers, firefighters, they need to have access to mental health professionals, licensed mental health professionals. John touched on an important issue, which is making sure that we have Medicaid and insurance companies are covering mental health treatment. And finally, we need to make sure we see the signs and can identify people who are suicidal. Death by suicide is going up exponentially. Obviously, COVID had a part of that, and we need to get so many more of these guns off the streets and away, out of the hands of people who do have mental health issues.
Thank you. Mr. Baker?
Thank you. This is an issue that I want to touch on. There's a couple of things that my colleagues have said here. You know, John King talked about the regional healthcare center that's open in Prince George's County, and he's absolutely right. It's one of the things that I've worked on during my administration. But the day it was open, we were 15 beds short. The waiting line in that hospital right now is 15 beds. But it not only affected the new regional medical center, it meant the place where we were going to expand our mental health, we couldn't do it because the governor arbitrarily cut bed access. So when we're talking about mental and behavioral health, which is also something that I experienced, the moment I was elected county executive, my wife was diagnosed with early onset dementia. And so it became very real to me as a family, but also very real to me as an elected official, that we had our schools where we weren't providing mental and behavioral health for our kids. And so what do? We expanded those, just like Doug said, we expanded those into our schools and into their families. But we have to have access. It's not just about having the programs, access and the funding for it. And as governor, that's what I would provide.
Thank you. Okay, next we're going to move to the middle of the table. This question is going to go to Mr. King, Mr. Jane, and Ms. Miller. The pandemic took a toll on healthcare workers, as we all know, and many of them have left the profession. What would your administration do to address the staffing shortages, and what incentives could the state do to attract and retain workers in the healthcare industry here in Maryland, starting with Mr. King?
Yeah, you know, I was just talking with a nurse educator about this crisis, and one of the things that we were discussing is not only do we have the challenge of folks leaving, but we don't have enough opportunities for new healthcare providers to get the training that is needed. There are a few things we should do. One is incentives for folks to choose careers in the health professions. We've got some loan forgiveness programs as a state that are helpful. We should expand those, particularly in regions of the state where it's hard to recruit folks. We should invest in the institutions that are doing the training, particularly our public higher ed institutions, our HBCUs. It's critically important that we have diverse healthcare providers so that we can tackle some of our racial equity gaps in healthcare. And then we've got to have incentives to try to retain people. Certainly pay matters. There was not consistent enough investment in hazard pay for healthcare providers during the COVID crisis, but working conditions matter. We had folks who were getting assaulted and harassed because of the hostility to some of the COVID safety protocols. That requires additional legal protection to make sure that we keep our healthcare providers safe.
Thank you. Mr. Jane, same question, staffing shortages in the healthcare industry.
Yeah, I mean, obviously COVID made things worse, but we were already on a decline even before COVID. And we have to really respect those who go into this field and actually help residents who are actually going through either physical or mental health issues. So we have to make sure as a governor, we actually invest in those training resources. We actually reduce the cost of living by helping with their student debt. We also have to make sure that we're investing in community college programs, four-year institutions, and even trade schools, so they actually get not only the resources, but the adequate training so that they actually feel supported. One of my programs on our website, janeforgovernor.com, is called the Maryland Now Plan. That's going to be fully paid for, eliminate the state income tax for 95% of Marylanders, make public transit completely free, and also provide a guaranteed job for someone, whether they're in the healthcare field or anywhere else, that is struggling to find work or maintain full employment. So when you look at all those issues comprehensively, reduce the cost of living, and make sure they have more disposable income in addition to better training, better accountability, better resources, I think that's how you not only start to reverse the trend of shortages, but actually make sure that we are truly honoring these healthcare workers the way they deserve.
Thank you. Ms. Miller?
So our frontline workers in healthcare have faced a lot of trauma over the last several years. And I think one of the most important things that we can do is make their environment safer, that they're able to get access to the tools that they need to be able to do their job, to increase their pay, and also for them to have paid leave off as well. Because I think when you go in and day out and you face the health crises that they've endured for the past several years, they also need to have mental health days off. So I think we need to be able to provide these services to them as well and to their family members. And again, it's about a holistic viewpoint that we are there for them just as they've been there for us. There are a lot of other tools that we can also examine, but I think one other one that we can do is make sure that we have them at the table and we understand what their needs are, because oftentimes we work in silos. We think we know what's best for everyone, and I know the Moore-Miller administration does not feel like that. We feel that those closest to the problem are closest to the solution, and they will be at the table when we determine what kind of tools they need to be successful in their jobs. Thank you.
Thank you. Okay, the next question down here to Mr. Perez and Mr. Siegel. We'll answer this one. As you may know, Maryland has the first in the nation prescription drug affordability board. Now, initially it will have purview only over local and state government prescription drug prices. Would you favor expanding the authority of that board and supporting legislation so that it could also set upper price limits for private insurance companies? First to Mr. Perez.
Can you hear me? First of all, I want to say thank you to Vinnie DeMarco, who was responsible for creation of that. It was a remarkable thing, and we have to bring down the cost of prescription drugs, and that's exactly what this does. What didn't happen was the governor failed to fully fund it during its first year. So it's gotten off to a slower start than it should have been. And again, as your governor, we're going to work together to address these issues. We're not going to work at cross purposes. What we also have to do is to expand the scope of things so that we need to make sure that the board has the authority to make higher cost drugs more affordable by setting upper payment limits. You hear about things like people paying ridiculous amounts of money for insulin. And so we need to do this. And we also, in addition to what Vinnie and Democrats have been doing, we need to make sure we are pressuring the federal government as well. It is nuts that we have a system where the VA can negotiate for lower prices for its veterans, but we can't do it in Medicare. And I will make sure we work together. I'm going to send a letter to the Secretary of Health and Human Services day one to allow us the authority to import maintenance medications from Canada. They have the authority to do that, and we're going to do everything we can to bring down the cost of prescription drugs.
Thank you. Mr. Siegel, the Prescription Drug Affordability Board, should it cover private insurance?
Well, as I said before, I come to this as a socialist. The model.
I'm not sure you're on.
As I said before, I come to this as a socialist. Our model is to each according to their needs. That's our social contract, okay? The model is basically how we function inside of a family. There's a conflict between the profit motive that is behind almost all the corporations in this country and the service of meeting people's needs. And the question is, how do we deal with that? As a socialist, we've got tools in our toolbox that other people don't have. Now, one of the big things that's happening right now that's really extraordinary is that the major corporations in America are rethinking the bottom line ethos, at least verbally. So the Business Roundtable, for instance, came out with something that said actually that the profit motive no longer is the adequate basis for being a corporate executive. The question is, how do we turn that into reality? So part of one thing that we're interested in on the state level is we would like to start a new kind of corporation, something in between a profit-making corporation and a nonprofit. I'd call it a V corporation, a value corporation, that has a much wider sense of what its motives are and what it is responsive to. And last thing, if corporations don't serve the public, we'll step in as socialists and we'll create our own drug company, the Maryland Drug Company, and meet the need head on and chase them right out of business.
Thank you. All right, everybody, let's take a deep breath. You've made it through 2 rounds. We have one more round of questions. And then we'll get to audience questions in a minute. And thank you for respecting the time. You all are doing a great job so far, so let's keep that up. Next question, back to the end of the table. This is going to be Mr. Gansler and Mr. Baker to answer this one. No. I'm trying to mix it up a little bit. He'll get the next question. Okay, Mr. Gansler, Mr. Baker. Although fully implementing the Affordable Care Act, Maryland has made progress in expanding health care to 400,000 additional people, but there's still about 6% of Marylanders who are uninsured. What measures would you support that would get that 6% uninsured number down to 0 or as close as possible? Mr. Gansler, you go first.
Yeah, it's an incredibly low number, actually, 5%, 6%, whatever the number is. And most of those folks actually are younger people that choose not to have health care and insurance. So we're doing, as I said at the top, we're doing very, very well. We do have people like Vinnie DeMarco and others, legislators here that are in the room, Deltrude Bursberger on the federal side, that are working so hard to make sure people have access to the Affordable Care Act or insurance coverage through their companies where they work. And right now, unemployment is also low. It's easier to get a job than it's ever been. But that doesn't mean we don't have to make sure everybody's informed about how they themselves can get coverage and make sure that they have insurance. Because the problem, of course, is when it's a catastrophic injury and you don't have the ability to pay for it, that's going to be a problem. And young people don't always see it that way. So we have to make sure that we reach out to every Marylander, that everybody has access to insurance and health care coverage. We have to make sure we keep the Affordable Care Act, because this is going to be the biggest Republican year of our lifetime, and things are going to change in the legislature in Maryland as well as on the federal side, and we need to make sure we protect our health care systems here in Maryland.
Thank you. Mr. Baker, how would you address the uninsured Marylanders and bringing that number down?
Thank you. One of the things I want to say that my good friend Doug Gansler said, experience matters, and it does matter. I spent 8 years as county executive, dealing with health insurance, which is one of the biggest costs on government, not only at the local level, but at the state level. And so, yes, Obamacare was great. It allowed us to cut our uninsured and underinsured about 50%, but it didn't get us all the way. So we as a state and as governor, what we have to work toward is going toward Medicare for all. We take the steps now at the state level, but we have to be a leader nationwide in moving us toward that. Because we do need those young people to be covered. That's how we keep the cost down. But unless we actually move toward Medicare for all, then we're going to see the rising costs. That's where government cost comes in. Most of the things when you see government at the local level making cuts, it's because of the cost of prescription drugs and health care. If you see them making cuts at the state level, it's because of prescription drugs and health care. So unless we get our arms around it, we won't have the resources to put into the other programs. As governor, I would move us toward that and being a leader, just like Massachusetts was, in this effort. It's nationwide. Thank you.
Thank you. Okay, next question is to Mr. King, Mr. Jane, and Mr. Barron. I've got you here. So we're going to talk about gun violence. Now, it's a multifaceted challenge with mass shootings, as we have seen. Also, community daily violence, suicides, intimate partner and family violence. Now, this is not just a challenge for police and the judicial system. Many see gun violence as a public health crisis. How would you use a public health lens in approaching the problem of gun violence in our communities? First to Mr. King.
When I was a teacher and principal, I had the horrific experience of sitting in a living room with a mom who just lost a son to gun violence. So this crisis that we face as a country around gun violence, I understand deeply and have seen directly. What we have to do is, as we think of it as a public health crisis, of course, we have to make sure we have the strongest possible gun control laws. And we are fortunate that in Maryland we have strong laws that could be strengthened around things like child access prevention. I'm glad the General Assembly passed the ban on ghost guns. Those are critical. But that's not enough. We also need to tackle mental health services, addiction treatment. We have to do a much better job engaging our young people. We need rec centers and summer jobs for our teens. We need to make sure that we provide reentry supports for folks who are returning home from incarceration. We have to have trauma response teams that go out and respond to incidents in the community so that police can focus on stopping the flow of illegal guns. And we need to invest in proven violence prevention programs like Safe Streets to make sure that we bring down the violence.
Thank you. Mr. Jane, gun violence is a public health issue.
It is, and I'm really sick and tired of candidates and politicians every time there's a mass shooting saying we offer our thoughts and prayers, but fail to actually have concrete actions and solutions. We've seen this time and time again. Enough is enough. And so that's why, for example, in 2018, after the Parkland shooting, I helped organize a student-led workshop that advocated for our legislature to actually ban rapid trigger devices and keep guns out of the hands of domestic abusers. Beyond that, we have to make sure that if you own a rifle or a shotgun, you also need to get a permit. Right now, you do not need to. We obviously support red flag laws. I'm really happy that we finally banned ghost guns at a statewide level. We have to also look at the entire criminal justice system comprehensively. That means removing and replacing SROs in all of our public schools and investing in more guidance counselors and social workers. It means making sure that we end the money bail system and extreme sentences for children. Prepare those who are in prison for life outside of prison so they can get access to good jobs, and we're not just warehousing people and just going back and forth through all these struggles. We have to invest in mental health in our schools, in our criminal justice system. We also have to address the opioid crisis by decriminalizing scheduled drugs like cocaine, heroin, and meth, and instead of sending you to prison because of personal possession, sending you to a local and fully funded rehab center so we actually get to the root causes of why we have so many of these issues time and time again.
Thank you. And coming back down to this end of the table, we're going to have Mr. Siegel, Ms. Miller, and Mr. Perez answer this question.
Now, this time you really are overlooking.
Oh my gosh, I'm so sorry.
Right, now I'm taking it personally.
No, it's my fault. I changed up the order and I went right over. Mr. Barron, yes. As a public health issue, how would you address gun violence?
Well, I thank you for asking. The events in Texas and Uvalde and in Buffalo and so many others are heartbreaking to see. And they just seem to happen again and again with increasing frequency. Maryland does have strong gun laws, background checks, a ban on assault weapons. We banned ghost guns recently. All of that is to the good. The problem is we really need federal legislation because guns, of course, come across state lines. But there's something concrete that we could do in Maryland in addition that would likely make a big difference. More than half, recent analysis found that more than half of school shootings were conducted by youth who got a hold of their parents' guns that were not secured. So I have proposed, one of my main proposals in this area is in the area of gun storage, that all gun owners, and this is the law in Massachusetts and Oregon, we should do it here in Maryland, all gun owners are required to have their guns stored and locked when it is not in use. And there have been studies showing that when this is done, it actually results in people do it. They actually store safely. This is a common sense solution that we should do statewide.
Mr. Barron, thank you. And again, my apologies. Okay, now for real, we're coming down this way. Mr. Siegel, Ms. Miller, Mr. Perez. According to the CDC, the leading cause of death in Maryland is heart disease. What would your administration do to encourage residents to eat well and manage their stress and reduce their risk factors for heart disease? What would that look like? Mr. Siegel, you go first.
This goes back to the fundamental issue that's facing the state. All right, this goes back to the fundamental issue that's facing the state. And it's what we talked about a few years ago on everyone's mind, which is education. And we all think we resolved that with this thing called the blueprint, right? The blueprint has got two parts. One is a social justice, and maybe we did a great deal on that. The other has to do with the purposes of the schools. In truth, it's a terrible document. I actually taught philosophy of education at the University of Pennsylvania, so I know a little bit of what I'm talking about. It's an impoverished document that has a totally limited conception of the purpose of public schools. One of the purposes that it doesn't focus on at all is actually has to do with education to improve the lives and keep people alive. And one of the sources having to do with heart disease actually is getting people to realize actually that as young people, that the biggest wealth they have is actually what they're born with, which is most people, at any rate, which is a healthy mind and a healthy body. And what happens is that as you get older, that wealth diminishes. In fact, when we die, it goes down to zero. We all die broke, actually. But the question is, how long can you keep it healthy? How long can you keep wealthy? And that's what we need to teach in our schools from the day one. And we've got to rethink the whole purpose of schools in this state. And that's the number one issue for me, at any rate, is education.
Thank you. Ms. Miller, how would your administration address the problem of heart disease?
Thank you very much for that question. Heart disease is the leading cause both for males and females in our nation and in the state as far as killer goes. So one of the most important ways I think we can reduce heart disease, number one, is to make sure that tobacco products are absolutely discouraged for use. That includes just regular cigarettes as well as e-cigarettes. When I was in the General Assembly, I proposed one of the first pieces of legislation that banned e-cigarette use to minors. So I think it's imperative that we have workplaces and public places that are tobacco-free product areas. Two, we have to make sure that we reduce stress for individuals to make sure that they also are not drinking a lot of alcohol. That also leads to heart disease. We want to make sure that lead that's in the water, in the air, in the paint, that is reduced, pollution is reduced. So a lot of different factors go into heart disease, including eating healthy. So government has a big role in making sure that we advocate for having a healthy lifestyle and making sure those that are living in marginalized communities have access to good food and that they have clean air and clean water to drink. Thank you.
Thank you. Mr. Perez, heart disease.
Well, this one's personal because I was 12 years old and my dad dropped dead of a heart attack in the basement of our home. So I know a little bit about this. Step one, make sure every Marylander has access to health insurance. 6%, as you said, don't have it. In my experience on the Kaiser Commission on Medicaid and the uninsured, they weren't uninsured because they chose not to be. In Maryland, I have a plan, and I've outlined it already. And a substantial percentage of the uninsured are undocumented. Immigration status should be irrelevant to your eligibility for health insurance in this state, period, end of story. What we also need to do is understand the racial and ethnic lens through which this question must be asked. Because heart disease is an issue, but it is disproportionately an issue for African Americans and Latinos, and we need to understand that. We need to view everything we're doing in the healthcare setting through that racial equity lens, because we are the richest state in the country and we have remarkably troubling disparities in maternal infant mortality and so many other things that we have to address. And finally, the reason why everyone has to have health insurance is you can get preventive care. Prevent this stuff from happening before you have what my dad had in the basement of the house. This one's personal.
Thank you. Okay, we've made it all the way through almost. Y'all are doing a great job again with the time limits. This last question goes to everybody, so everybody can answer this one. Then again, we'll have audience questions, and you will have a minute at the end for any closing remarks or anything that you didn't get to bring up. So here's a question for everybody, and we'll work our way down the table, starting from Mr. Siegel all the way down to Mr. Baker. So as everyone here knows, the Supreme Court appears poised to overturn Roe versus Wade. The Maryland General Assembly this year passed legislation to provide funding to train providers in reproductive health care. Now, Governor Hogan has elected not to spend the fenced-off money that he could starting on July 1st. Given that Maryland could see an increase in demand for abortion care services in Maryland, what would you as governor do? Starting with Mr. Siegel.
Is that on? Okay, thanks. Look, this is the big issue that's tearing the country apart. Maryland has got its own values. Mississippi has got its values. Okay, we stand up for ours. If people come to Maryland because their rights can't be protected in other parts of the United States, I say welcome, and I say we make Maryland actually and take pride in it, a place not only where you can come if you have to deal with reproductive rights, you can come and settle here. There's a lot here. We want to turn Maryland into the quality of life state. That's what Bread and Roses is about. Basically, it's not just one issue. It really is going to a new vision of development that's not mass consumption and not growth. It's turning it into a higher quality of life that is a model. We can make it a model for the country and a model for the world, and that locks in with climate change and almost every other issue that we're talking about. That's what the Roses part is about. We're at the end stage. We're end stage of 200 years of industrialization and mass consumption, and we're struggling now with the difficult problems of the end of that age, but what we need actually is to go on to the future, and the future can be very different and much more positive than anything we've seen.
Thank you. Mr. Perez, Abortion Services.
The next governor needs to lead and partner. This governor has not led and partnered on this. Again, I had the privilege in 1994 when Congress passed the FACE Act. I was a career civil rights prosecutor. We implemented the Freedom of Access to Clinic Entrances Act. When Dr. Slepian was murdered in Buffalo, 2 miles from my house where I grew up, that was another case brought when I was in the Civil Rights Division. 2009, when Dr. Tiller was killed in Kansas, I went out to Kansas when I was the head of the Civil Rights Division. Folks, here's what we need to do. We need to make sure we fund the bill. We need to expand the universe of providers, as was done in the bill. Thank you, Delegate Kelly and other Democrats. We need to pass another bill that will allow the Attorney General's office to represent any provider who gets sued because of these idiotic laws in other states like West Virginia and Texas and elsewhere. We need to set up a standing task force of state, federal, and local law enforcement, because I can tell you, folks, we are going to become a target as a state. I say that with regrettable experience. And so we need to set that up proactively. And when we do all these things and pass a constitutional amendment, which we must do, then we will be in a better position.
Thank you. Ms. Miller?
Thank you very much. This is why elections matters. We have a governor right now who's refusing to release the funds to be able to provide our trainers, to be able to provide safe, legal access. So on day one, the Moore-Miller administration is going to release those funds and make sure it is available to provide for training. Two, we're going to make sure that we enshrine a women's right to safe legal access in our Maryland Constitution. No ifs, no buts. We will make sure that'll happen. You have a governor here right now that refuses to be able to play along with the legislature, to be able to provide the most important thing, to have legal access to abortion. Look, just because the Supreme Court is thinking of banning abortion, you're not going to be able to ban abortion. What you're going to do is, provide situations where women do not have legal and safe access to abortion. That's what's going to happen. So therefore, it is very important in this election coming forward that we elect a governor that is going to recognize the important needs of women throughout the state of Maryland. And we hope that it will be Wes Moore and Aruna Miller. Thank you.
Thank you. Mr. King.
Well, for my running mate, Michelle Seary from Baltimore County, who runs the Women's Law Center of Maryland and was the president of the Planned Parenthood Board here in Maryland, this is a critical commitment. We want Maryland to be the North Star on abortion rights. That means we need to adopt a constitutional amendment. It means we need to fund the training of providers. It also means we need to expedite licensing for the new categories of providers who the legislature added as potential providers of abortion services. It also means we need legal protections for providers who are providing services to folks from other states who are abortion refugees. It means that we need to have look at the legal protections that California and Connecticut are pursuing so that those who are accessing abortion services in Maryland are protected from onerous state laws that are being adopted around the country. We also need to think more broadly about other areas of privacy protection where Maryland should be leading. Unfortunately, this year the General Assembly didn't pass, for example, the Trans Health Equity Act. They should have. We ought to be doing more to make sure that we protect access to contraceptives and make sure that all folks have health care as a human right so that they can access that care.
Thank you. Okay, Mr. Jane, same question.
Yeah, thank you so much for that question. So first of all, there's no such thing as pro-choice. You're either for safe health care or you're not. It's as simple as that. That's why I was the first statewide candidate in this election back in January of 2021 to release a comprehensive reproductive justice platform. That platform includes enshrining health care like abortion access, contraceptive care, and gender affirmation treatment within our state constitution. It talks about making sure that we have comprehensive sex ed in all of our public health classes in schools that teach everything from abstinence to contraceptives to gender identity to domestic violence, making sure we remove parental consent for those who seek abortions, making sure that we have the availability of medication abortion in all of our pharmacies, especially for those in rural communities. We have to make sure we have free menstrual products in all of our public restrooms. We have to make sure we have lactation accommodations for new mothers that re-enter the workforce. And we have to make this state an abortion sanctuary so that if you need the health care, you're able to get so in a safe, accessible, and affordable manner.
Thank you. Mr. Gansler?
My Lieutenant Governor, Candace Hollingsworth, and I will be a brick wall against any attempts to chip away at a woman's right to abortion and any attempt to chip away at reproductive rights. When I was Attorney General, I took on the Bush administration for doing just that. Of course, we released the $3.5 million and whatever else is necessary to make sure that Maryland can be a place where women are safe and feel free to come to have an abortion. Judges matter. We're seeing it on the Supreme Court. That's why we're even having this conversation. That's why I started this conversation a year ago, knowing full well what the Supreme Court was going to do here. Right now in Maryland, 6 out of the 7 Court of Appeals judges were appointed by Governor Hogan. Another 4 years or 8 years of Republican leadership, that will permeate all the way down to put any legal rights regarding access to abortion in jeopardy. Experience does matter. I led the fight on the statewide level for marriage equality. I wrote an opinion recognizing out-of-state same-sex marriage, and for that, the right-wing Republicans literally began impeachment proceedings against me. Having a Democratic governor, understanding how the legislature works, understanding how laws work, having experience, not rhetoric, but actual experience, is going to matter going forward. And we have to win. We have to have a Democrat that can actually win the general election. I believe a Democrat can win this year.
Thank you. Mr. Barron.
Thank you. The decision of whether to become a parent and when to become a parent is just about the most consequential decision a person can make in their life. And the idea that from the moment of conception that the government is going to be making that decision rather than the individual woman is absolutely appalling to me. It is the opposite of conservative. It's government intrusion into the biggest decisions in people's lives. So I support enshrining, as governor, I would strongly support enshrining the protections of Roe v. Wade in the Maryland Constitution. I support releasing of the funds, training physicians' assistants and other healthcare providers to provide abortion services. One other area that the Barron administration would lead on is in preventing unintended pregnancies. Now, my philanthropic team tested and funded the expansion of a program called Teen Options to Prevent Pregnancy. It's for adolescent mothers, many of whom go ahead and have an additional child. That's a sizable percentage of teen parenthood. It provides them with, this program provides them with long-acting reversible contraceptives. It reduces the rate of unintended pregnancies by more than half.
Thank you. Mr. Baker.
You know, I agree with what has been said here. Yes, we should enshrine it in the Constitution. Yes, we should release the funds. But let's be real. This is not a question about a woman's right to choose. This is really a question about poor women and women of color. Because that's really what we're talking about. In all those states where you see this ban going on, they're not banning it. Because those other folks have choices. And what we have to do here in this state is not just do the things here, but use our oversized voice right next to the nation's capital to say this is wrong and to lead the effort statewide. Not just be satisfied with what we're doing within our borders. Because this really is an attack. It's an attack on a woman's right to choose, but it's also an attack on health care. Health care is about poverty and color. Poverty and color. And we as a state should take offense to it and actually lead the charge. That is what I want to do. I want to be on the Sunday morning shows making these people feel guilty about what they're doing, holding them accountable on behalf of this state. Thank you.
Thank you. All right, you made it through the gauntlet of my questions. So, all right, God, give them a round of applause. Now you have to face the audience. And I have several questions from them here. So these questions are for anybody and everybody to answer. You don't have to answer everyone, but feel free to answer as many as you would like. The only catch is that you get 1 minute this time. So quite brief answers. All right, the first question we have from the audience. Mental health crises and crime are often confused by those who aren't trained and skilled to know the difference. What can be done to address this issue so that those who actually need care get treatment instead of being locked up? So, all right, we'll start with Mr. Perez.
Well, we need to build out a community mental health infrastructure. We don't have that. I worked with a lot of police departments where people were getting killed by police officers, suicide by cop, because we don't have assertive community treatment teams. We don't have the de-escalation capacity. We need to understand that. We also need to understand that mental health issues and opioid addiction are often first cousins, and we need to provide treatment where they are. When someone is incarcerated, we need to provide that treatment there, because if we don't, guess what's going to happen? Something really bad when they get out. And as your governor, we're going to make sure we make this a priority, because we have to build out a community mental health and behavioral health infrastructure. And the next governor's got a golden opportunity to do this, because we have the opioid settlement that's going to give us so much money. We've got so much will to do this, but we've got to make it work. And the next governor's going to have to be that implementer in chief. And I've worked with a lot of police departments to make sure they've been able to do this.
Okay, thank you. I see everybody's very eager. We'll go to Mr. Siegel next. We'll get you all.
What we have to realize is that we actually know at least part of the solution to this, because there are programs on the West Coast, for instance, one's called Boots. And what they found actually is that 85% of the calls that come in, where in the past police were sent out, 85% of them, they don't need to send out someone with a gun, and they send out someone with the right social skills and training. So what we need really are two things. We need at the dispatch level people who can distinguish in a protocol that allows them to distinguish, and then we need a core of people who know how to go out there and deal with someone who's got mental health problem. But the solution's already there. The model is proven. We just need to have the will to do it and put a little bit of our money behind it.
Thank you. All right, who else wants to give this one a go? All right, I see Mr. Jane.
Yeah, I mean, and I mentioned this in some of my earlier answers, we have to address mental health in the school systems and also in our criminal justice system. That means investing in more guidance counselors and social workers in our schools, so we're getting to the root causes of these issues and making sure that, you know, we're not leading these students to failure outside of school. We have to make sure that we're training our 911 dispatchers, and this is found in my criminal justice platform and in my healthcare platform and in my education platform, all found at janeforgovernor.com, where we talk about, instead of sending only a law enforcement officer to help someone who has a disability, who has a mental health issue, train and send a social worker instead. We also have to make sure we decriminalize scheduled drugs, like I mentioned earlier, so we're not just sending folks to jail if they have a drug problem, but we're sending them to a local and fully funded rehab center. And we also have to have more dedicated funding for nonprofits that are already doing this work, meeting people where they are within the communities, and working at a healthcare nonprofit right now. I understand how every end of the fiscal cycle we're begging for the same money. And so as governor, I would make sure that we have that dedicated revenue stream.
Thank you. Thank you. Mr. Baker?
Yes. You know, these are some good ideas, and this is actually what I did as county executive. Because if you go to 911, you know, then you'll get the police to come there. That's why we develop our 311. So we don't have to have the dispatch at 911 make the decision. When you're calling 311, that's a non-emergency call. That means we're going to send our fire EMT out there. We also have to have the training not only for our police department, but also for our fire department to understand this. And then we put more money into our health care and had our social workers and our health cares actually training with the police department and the fire department so they could go out on these calls. But that means, as governor, you're providing the funds, because it's at the local level where these things take place. That means, as governor, what I want to do is actually work with the local jurisdictions to make sure they have the training for both their police department, their fire department, and the resources for their social workers and their health department.
Thank you. Mr. Gansler?
Yeah, I would commend anyone watching to our Mental Health Matters plan on our website. We're the first candidate to come up with this plan because it's so important. We talked about earlier having licensed mental health professionals in the schools for every 250 students, available for first responders. You know, I was in the criminal justice system for 22 years. I was a federal prosecutor for 6 years under Eric Holder. I was the state's attorney in Montgomery County for 8 years and your attorney general for 8 years. And we actually addressed this issue going years back. We had something called an EAP. So when a call came in, it was a mental health call, we made sure we sent out mental health professionals to deal with that call in addition to police, because these situations unfortunately often become volatile and violent. So we need to make sure that we address those issues. And as part of the process of criminal justice reform, keeping crime down and justice up, we're going to have prosecutors at the inception of the cases so we can divert cases where they're mental health defendants into the mental health system as opposed to in jail.
Thank you. Mr. Barron?
Thank you. So this is an area where we need programs, effective mental health supports for people who are vulnerable, not just well-meaning programs. One example, and again, my philanthropic team funded the expansion of a program for people who are with severe mental illness that are being discharged from mental hospitals or homeless shelters. Many of them end up in the criminal justice system. Many of them end up homeless. Again, many of them end up in mental hospitals. It's called critical time intervention. It pairs them with a case manager who identifies supports in the community and in their family and basically builds a support system and trains the support providers. It's been shown to reduce the rate of recurrent homelessness by about 60%, and it actually saves the government money, because if these people end up in the criminal justice system or in a mental hospital, which is extremely expensive, that's a bad alternative, and it's an extremely expensive one. So this is a no-brainer. It saves money, really reduces homelessness in a meaningful way.
Thank you. Thank you. Mr. King?
I was recently talking with a school counselor in Prince George's County who is single-handedly responsible for providing socio-emotional supports to 700 students and their families. That can't work. And so we need to invest in school-based mental health services and school counselors. We need to invest in a community mental health infrastructure. We need to invest in addiction treatment providers, particularly in regions of the state where it's hard to find recovery beds. We need to invest in mental health services in our prisons. But to do this, we need revenue. And one of the challenges, you've heard a lot about the investments we should make, but not much willingness to talk about the revenue source. We need to make sure that large corporations and the folks who are making over $1 million a year pay their fair share in taxes so that we have the resources to actually make these investments. For example, we have a desperate need for more psychiatric beds in the state. We won't be able to provide those if we don't commit to the revenue that is needed.
Thank you. And Ms. Miller.
Thank you for that question. So we met with the sheriff. It's not on. Can you hear me? Okay, there we go. Thank you for that question. So Wes and I recently met with a sheriff in Charles County, and one of the things that he described is what their units do out there. They have what's called a mobile crisis response units. So basically, they go to meet where the people are. And what they will do is they'll have a law enforcement officer, much like what many of the panelists here said, along with the social worker, along with the EMT, so to de-escalate the situation. Now, when you get to that situation, there's really not many options. There's three that they have. Either they send the individual to a hospital and make sure that there's a bed there, or they go to an emergency room, or they end up in jail. That's not enough options for those that are suffering from acute mental health matters and behavioral problems. We as a state need to do more and think of better options and fund these. Thank you.
Thank you. Okay, next question from the audience. As governor, of course, you are in charge of a vast array of state agencies that provide important services. So the behavioral health, disabilities, and other divisions of Maryland Medicaid are difficult for people with multiple diagnoses to navigate to receive their services. What can your administration do to make our healthcare system easier to navigate? This is specifically within state government. So anybody want to attack that one? Mr. Baker.
Thank you. The first thing is understand how the government works. Most of those services are actually provided at the local level in combination with the state, because the governor appoints the health officer for every jurisdiction in conjunction with the county executive and the mayor. And so what we find at the local level is that the state makes cuts, whether it's to our health officers, whether it's to our social workers, and to our family services, and it has impact on what services we can provide at the local level. As governor, I understand that. And so what I want to say to those jurisdictions out there, the city of Baltimore and the rest of the counties, is that you have a governor that actually understands we need to partner with you to give you the resources to provide the services at the ground level. And so that's what I would do as governor.
Thank you. Mr. Jane.
So one of the experiences I had working in the Obama administration was in an office called Presidential Personnel. So I was part of a small team that found, recruited, appointed, and retained all the political appointees in the federal government, from cabinet level secretaries all the way down to junior level special assistants. And so I understand the need to hire folks that, number one, reflect the diversity of the constituents they are trying to serve, and also have the same lived experiences of folks who are actually having difficulties navigating the government process. We also have to make sure that we're including residents who are impacted by all these policies we're talking about, not after the election, but from day one of every operation, i.e. the campaigns that we have set up. Being the only statewide campaign in the United States that is 100% crowdsourced, that means every policy, every strategy that we are running on the Jane campaign, on the Jane Latrice Hawkins Lice campaign, is run by residents from every age, every background in all 24 counties. So we make our policies more equitable, again, not just after the election, but from day one of our operation a year and a half ago.
Thank you. Okay, on making Medicaid easier to navigate, Mr. Perez.
You know, we have in Maryland actually a pretty good tool under Medicaid to structure our mental health and behavioral health infrastructure. Now, the problem is it hasn't been administered sufficiently by this administration. But for instance, we have the ability, let's say the issue is teen suicide. We have the ability under our current law to structure a program to address teen suicide, to make sure we have a provider network, to make sure they're appropriately compensated, and then to measure that, to make sure that we are getting it done well. But it hasn't been administered sufficiently by this administration. And that's why one of the most important questions for voters is the next governor is going to have to be the multitasker in chief. Frankly, there's been a remarkable brain drain at the Department of Health. It's a remarkably important place. It's a remarkably important job. We can do this work if we have the right people and the right leadership. We have the tool to do it.
Thank you. Mr. Siegel?
Let me answer this question personally, because I know actually a great deal about the problem of navigation. So 14 years ago, I was diagnosed with stage 3 pancreatic cancer. That meant I had less than a 5% chance of surviving, okay? Basically, I managed somehow or other to escape from Johns Hopkins, actually, and get to Seattle, where I got better treatment in a smaller place than I could have gotten at Hopkins. The problem isn't the system. The problem is that people have to know how to navigate themselves, right? You've got to know, and it really matters when you're facing something big and time is short. You've got to know what a clinical trial is, how to find out about it. You've got to know how to get a second opinion. You've got to know how to figure out and make decisions about which treatment option do you want, right? And you know how to have to move fast, right? Those are things that you've got to be prepared for, like an Apache is raised to face a certain kind of crisis, so when it hits, you're ready to deal with it. That's schooling.
Thank you, Mr. Siegel. I would remind everyone, please abide by the time limits, and also this question is about Maryland Medicaid, how to make it easier to navigate. I think, Mr. Barron, did you want to say something?
I did, yes, and I still do. We need folks in government, in the area of healthcare, Medicaid, and other areas who are knowledgeable and are live people who can answer the telephone and help navigate. There's, as opposed to a phone tree and getting lost into that. More than that, we need, wherever possible in healthcare, to meet people where they are in the community so they don't have to navigate the system. I talked about the pairing pharmacists with black barbershops for screenings for high blood pressure. There are programs that actually make it possible there's one called Capable, developed at Johns Hopkins, that's been tested and shown. It pairs older adults with carpenters and contractors to, rejigger their house so they can actually live there in a more functional way. We should also be enrolling people in healthcare through a turnkey operation in churches and so on, immigrants who are not yet enrolled in Maryland coverage.
Thank you. Thank you. Mr. Gansler, Maryland Medicaid.
Yeah, this is one of those issues where Rashawn Baker and I, being qualified to be governor, have actually done this kind of work. Attorneys general that are responsible, for example, of going after Medicaid fraud, which we did. We brought millions and millions of dollars back to the state. Attorneys general go after tobacco, vaping, alcohol, opioids, and bring money back to the state to make sure that there's health care available for all. I personally prosecuted Richard Gartman, who stole from Medicaid and from the health care system, and we put him in jail. The idea here is that when you represent all 56 units of government through the Attorney General's office, you're working on the legal side of things, but the implications on policy overflow. So you actually, from day one, you know how to do this, and you need to make sure that you hire the best and the brightest, the most diverse. When I left the AG's office and State's Attorney's office, we had more women supervisors than men, and we greatly enhanced the diversity of the office to make sure that we are, as John said, meeting people where they are.
Thank you. Anybody else like to talk about Maryland Medicaid and making it easier? Mr. King.
One of the things that we ultimately need to do is move to single payer. That would make the system much simpler to navigate for all patients. In the interim, We have to make sure that we move away from privatized managed care, who has an incentive to reduce the services that are provided to patients. We should have Medicaid reimbursing providers directly, not through a managed care provider, so that patients are getting the best care and not having their health decisions dictated by the profit interests of the for-profit managed care providers. We also need to make sure that our providers are more diverse. One of our challenges in the state is we don't have a racially diverse enough core of providers, and we don't have a large enough core of bilingual providers. And so we need the state to incentivize training, again, leveraging our HBCUs, our community colleges, our public higher ed institutions to train that diverse future core of healthcare providers.
Thank you. All right, it looks like we will move on to our last question from the audience. Again, 1 minute, and anybody can answer. What is your plan to ensure expanded healthcare access in our underserved minority communities? All right, Mr. Perez, you look eager.
I used to be the board chair of Casa Maryland, and we had a remarkably effective navigator program, Promotores, where you had people of the community organizing in the community. When we have 100% of our population insured, we will be able to address the issue that is in that question. Because who are the uninsured right now? Disproportionately people of color, disproportionately people who are undocumented. I was at a church in Baltimore County in Owings Mills yesterday, and I asked them, it's a Latino church. I asked them, what's the most important thing we could do to help your congregation? Answer, health insurance. Making sure that everybody living and working here can have access to health insurance. And when we have a diverse cadre of culturally competent providers, not only in government, but in the private sector, everywhere else, that is a remarkable way to bring folks in.
Thank you. Mr. Baker?
Yeah, the first thing that I worked on as county executive was building a new regional medical center. Not because I just wanted to build a building. It's because that's where the access to people who are underinsured and uninsured, which were mostly black and brown community. So building a new access to there, but that's not simply enough. Tom is right. There's a community out there that speaks English as a second language that's not going to come to our hospital because they don't have the transportation or access or know it. So we actually build federally qualified health centers throughout the county to make sure that every part people could come to. Those are just baby steps, though. In order for us to do this right, we really have to change the system. It is costing us more money than we think. It was the number one issue I had to deal with as an executive. Unless we move to Medicare for all, we're just playing. We have to make sure people throughout this state have access to quality health care where they live. That's what I want to guarantee as governor.
Thank you. Mr. Siegel.
Yeah. So all this is right and good, but I've been saying it before and I'll say it again. The issue of access to quality health care is much more complex than money and health insurance, right? People have to know, for instance, when to go to a doctor, right? People die all the time because they don't go to doctors. And if they have a serious problem, the time is short. They have to know how to move quickly. They have to know what the system can offer. They have to know its limitations. They have to know how to learn about clinical trials. They've got to at least know how to connect with somebody who can interpret for them choices that they face. Like, are you going to go for radiation or are you going to go for surgery? And you've got an hour to decide or a week to decide, and you're illiterate. So we've got to build, it's a deep problem. Health insurance is not going to, it just touches the surface. Right? We've got to turn this around and realize that taking care of our minds and bodies actually is the central product of our lives, and it's how our families will survive. And we have to be brought up with viewing that as much more important than our house, much more important and much more valuable than our house. So we've got to learn that from get-go.
Thank you. Okay, again, the question is about. Sorry about that. Let's see if this works. There we go. Sorry about that. Okay, again, the question, access in underserved communities. I think Mr. Barron.
Thank you. So we need programs, and we need to expand programs that aren't just well-meaning, don't just sound good, but have actually been tested and shown to improve the lives of people in underserved communities. As one example, my nonprofit worked closely with the Bush administration to establish a pilot, and then with the Obama administration to scale up to what is now a $400 million a year program that provides evidence-based home visitation services, nurse visitation services to women who are poor, pregnant with their first child, and single. These are women who have very few resources, they don't have a partner, and they're pregnant with their first child and scared about their health. The nurse visits during pregnancy, the first 2 years of the child's life, teaches her parenting, nutrition, not to smoke, not to drink, how to practice birth control so she doesn't immediately have another child. It's been shown to reduce the rate of child abuse and neglect by more than 1/3 and to produce long-term gains in educational outcomes of the children of these mothers. We need effective programs like these. We must expand them.
Thank you. Mr. Gansler?
Thank you. Yeah, one of the reasons why I started the Family Justice Center in Rockville, and we're going to have family justice centers throughout the state, is to address this type of issue where families don't have the information. They may not be here legally. They may have speech, language barriers. Montgomery County, where some of us come from, is the most diverse county in the state, and we need to make sure that we provide access to health care for every individual in the state, whether it's through a family justice center, whether it's through just outreach from the government, making sure forms are translated into a variety of languages, making sure we have health clinics in underserved communities. Look, government is there to help underserved communities, people that need the help of government, and we need to make sure that, like my history of being in government has shown, that we do reach out to underserved communities. We have diversity in our office. Candace Hollingsworth, who's the mayor of Hyattsville, then started our Black Party as my lieutenant governor, did just that as the mayor of Hyattsville.
Thank you. Anyone else? Mr. King?
Yeah, it's important to recognize that access to health care is not enough. Actually, what people need is health care. And the best way to ensure that is single payer, so that we're providing health care as a human right. In the interim, we ought to make sure that we create a parallel system to Medicaid that is available to those who are undocumented, as well as giving folks who are undocumented access to the insurance exchange. That's the way to begin to address our health disparities. We need a statewide commission on racial disparities in healthcare. We have horrific and deeply disturbing disparities in maternal health care for African American women. We need a commission that makes recommendations that are binding, that we act on. But then we've got to tackle social determinants of health. If folks don't have affordable housing, their health is going to be worse. If they can't find healthy food in their neighborhood, their health is going to be worse. If they are living near an incinerator or other sources of pollution, their health is going to be worse. And so we need to bring a racial equity lens to every policy area to make sure we address these health disparities.
Thank you. All right, I see no other hands, so we will move on. Thank you for answering those questions. We now have 1 minute each for closing remarks. You can speak generally, any topic that wasn't addressed, the time is yours. Since we did the abortion question this way, we'll do the closing remarks this way. So we will start with Mr. Baker. You have 1 minute.
Thank you, and thank you for doing this. You know, one of the things that I want to talk about in the last minute is I believe it's time for Democrats to stop apologizing for being Democrats. We're the party that hopes for that works for the best, that hopes for the best and works for it. This is something that Deval Patrick said. We need Maryland to be a national leader on the urgent problems that we have before our state today. You know, there are things that are facing us we haven't talked about. We haven't talked about the gun violence that we see, not just in Baltimore City, but around this state. That young black and brown people are being killed, and we treat it as is normal. We haven't talked about the fact that COVID has completely upended our lives, and everything we thought we were going to do before COVID, we have to rethink. And if you don't have the experience to do that, it's not just what you say or what you believe. If you can't get it done, then this state will suffer. I'm going to get it done as governor. Thank you.
Thank you. Y'all can go ahead and applaud now if you want. Just please try not to applaud while they're talking so that the folks can hear. But go ahead, Mr. Barron, you're next.
So one of the things that I've emphasized in this forum and throughout the campaign is the importance of expanding programs and policy solutions that don't just sound good, aren't just well-meaning, but have actually been tested in the real world and shown to make a big difference in people's lives. I've given examples today. But why do we need to do this? The answer is, and you won't hear this from many Democrats, a lot of government programs, no matter how well-meaning, no matter how large they are, no matter how long they've been around, do not work. They don't actually improve people's lives. That's what distinguishes me from the other candidates. We can't just go on spending money and assume all these logically sounding programs, they sound good, they're well-intentioned, that they're actually going to move the needle on problems. Many of them won't. Many of them don't. That's why healthcare costs have been rising and rising and rising for 20 years, despite many different attempts to slow them. We need solutions that are tested, shown. We need to focus like a laser beam on them if we're really going to move the needle on healthcare costs and health and other outcomes.
Thank you.
The number one public health problem we have is crime. Right now, there's 400 people that are slaughtered every year in Baltimore City, most of whom come from underserved communities, most of whom are of color, and it's an absolute tragedy. Nobody seems to be doing anything about it. No one seems to care. I've actually, there's nobody else in this race on either side that has any background whatsoever in criminal justice. I've made a career of keeping crime down and bringing justice up. I was the head of the NAACP Criminal Justice Committee in 1989 before I had children in Montgomery County, making sure we worked on diversity issues. When I was state's attorney, we put every police shooting in the grand jury, let them decide whether that was a justified shooting or not. I started the first drug courts in Maryland's history because we put too many people in jail and we need to give them an avenue out. I started the first domestic violence dockets in Maryland's history. I started the Family Justice Center. We have to get 1,000 more police officers on our streets that are trained to keep people safe in underserved communities, 10,000 lights in Baltimore City, but most importantly, we need a Democrat that can actually win this election. We really can win. It's not out of our control. We just need the right messenger with the right message.
Thank you. Go ahead, Mr. Jain.
Yeah, my name's Ashwani Jain, and I'm running for governor to make politics inclusive and accessible. So here are 4 reasons why you should vote for me. Number 1, even though I would be the nation's youngest governor, I've already been able to work in the public, private, and nonprofit sectors, the Obama White House, and 2 federal agencies. Number 2, I'm fully accessible. 100% of our events are free, and I'm the only governor candidate to spend 90% of my time meeting voters at their homes in all 24 counties. Number 3, I'm fully accountable. 100% of our campaign is run by residents from all ages, all backgrounds, and every single county. And number 4, we are fully transparent. We have shared the most comprehensive, detailed, and fully paid for policy agenda a year and a half ago in January of 2021. Each policy was made by residents, not consultants, and you can go to janeforgovernor.com to learn more, to schedule a one-on-one with me, or to join us. Thank you so much for this opportunity, and thank you so much for moderating.
Thank you. Mr. King.
There are people who say that the idea that government can be a force for good in people's lives is a long shot. There are people who say that treating healthcare as a human right, treating reproductive freedom as a human right, treating housing as a human right, treating quality education as a human right is a long shot. And to those people, I say my whole life has been a long shot. I'm sitting here because of the role public schools played in my life. Both my parents passed away when I was a kid. My mom when I was 8 and my dad when I was 12. In the period when it was just my dad and me, my dad was struggling with Alzheimer's. Home was incredibly difficult. I didn't know what my father would be like from one night to the next. I am sitting here because of great teachers who made school a place where I could thrive and become a teacher, a principal, a leader of schools at the local and state level, and serve as Secretary of Education for President Obama with a budget $15 billion bigger than the budget of the state of Maryland. We can deliver on that vision of a more just and prosperous future. I hope folks will check us out at johnkingforgovernor.com and support our campaign.
Thank you. Ms. Miller, go ahead.
Thank you, everyone, for being here, and also Pamela for moderating. Again, Westmore couldn't be here today because he did test positive, which is why I'm here instead. But I have to tell you that Westmore served as a U.S. Army combat veteran in the 82nd Airborne. One of the most important things he learned while he was there is to never leave a fallen soldier behind. This has been his guiding principle, not only when he served in the Army, but it will be in his ethics, the way he leads, and the way he governs. So here in Maryland, we don't need to leave anyone behind. We do have the resources and tools to make sure every Marylander can be successful through education, by protecting our environment, making sure transportation is accessible, making sure that they have food security and health security. So many ways we can make sure that no one will be left behind. And we humbly ask for your support, and we ask for your vote. Thank you for giving us the opportunity to be here.
Thank you. Mr. Perez, go ahead.
So sorry. Thank you, Chairman Lewis. Thank you, everybody here. Thank you, Congressman Ruppersberger, for your generation of leadership here. I'm very grateful. Folks, you know, we've had a couple dozen forums, and every forum I am struck by the critical importance of the issue. I'm struck by the work that has been done, and I am compelled by the unfinished business. You know, a society that loses its sense of moral outrage is doomed to extinction. We have so many challenges right now, and the next governor is going to have to be the multitasker in chief. Shannon Sneed and I are running for governor and lieutenant governor because we're proud members of the GSD wing of the Democratic Party. We want to get stuff done. We want to make sure that we're fighting for jobs, justice, and opportunity for everyone. That has been our life's work. And I'm so proud to have the support of so many people around the state, whether it's 250,000 labor union members and their families, whether it's leaders around the state, whether it's the Washington Post. They understand that the next governor needs to hit the ground running day one, and we will do exactly that. Thank you so much for having us tonight.
Thank you. And Mr. Siegel, you have the last word.
So I'm a philosopher, social theorist. I'm a philosopher and a social theorist, but one who actually spent his life in government. I worked on the Hill. I was on the staff of the House Budget Committee. I went into the executive branch, USAID, worked on international development, and was a senior advisor for agency planning, and then I spent 25 years at the School of Public Policy. I've always been interested in fundamental issues. What do we mean by progress? What's an economy for anyhow? What's the relationship between money and the good life? I wrote a book about this years ago called Graceful Simplicity. And it's a new social outlook that basically combines beauty and simple living. Now I call it Bread and Roses, or Bread and Roses humanism. I can't explain it in these sessions, but if I piqued your interest, I brought about 20 copies of the book. I put it out there. It's half price. It's $10. It was a Book of the Month Club's selection. It was translated into Chinese and Danish. So there's a can there. If you've got $10 and I piqued your interest, that I'm coming from a different place and have something interesting to say about policy, I think it's a good buy.
Thank you. All right, and thank you to all of our candidates. I'll turn it over to Yvette Lewis.
Thank you all so much. First of all, let us give our moderator a round of applause for keeping this thing on the rails, girl. Well done. Well done. Extremely well done. I'd like to thank our candidates for being here. So this is our fifth. This is our final. We at the State Party have tried to do our part. Now the rest is up to you. We've made all of these candidates available to you. We've tried to provide you with as much information as we possibly could. It is up to you now to continue to do your research, go to their websites, look at their policies, see what they have to say. If there are any other forums that are happening, please be sure you tune in or try to visit. This election is too important to have uninformed voters going to the polls. It is too important. Do your research, do your homework, and as I said before, choose wisely. I'd like to thank our sponsors who have sponsored all of these forums that we've had since the very beginning, GS Proctor and Associates and Velocity Capital. We are very grateful for their help in making these forums possible. All of the people that have come to each one of these forums in each of the counties for being present and being a part of our audience. We wanted to make it worth your while with the burger and a beer. I hope it was worth your while tonight to enjoy. We'd like to thank this beautiful facility for allowing us to be here. And once again, we wish you all the best. The voting is coming soon. Choose wisely. Thank you all very much.